Have you experienced or know anyone experiencing excruciating pain during their monthly period, which is accompanied by very heavy flow? They may be suffering from endometriosis. This condition is often misunderstood and underdiagnosed, but it affects millions of women worldwide. Many women are suffering in silence. Today, we will explore the risk factors, the causes, the symptoms, and treatment options for endometriosis, as well as the importance of raising awareness. Endometriosis is a condition where tissues similar to the lining of the uterus are found or grow in other parts of the body. It often affects the ovaries, the fallopian tubes, and tissues lining the pelvis. It may be found in organs beyond the pelvis, such as the bladder, the bowels, the rectum, the stomach, the vagina, even the lungs and the heart, just name it. Endometriosis can start at a person's first menstrual period and last until menopause. So statistically speaking, it roughly affects 10% of women of reproductive age and girls globally, that is 1 in 10 females worldwide, mostly diagnosed in women within their 20s and 30s, and it is said to affect 2 to 10% of American women between the ages of 25 and 40 years. The exact cause is unknown, but there are few theories surrounding its occurrence. So first is the blood or lymph transport system theory. So this just says that endometrial tissues are transported to other areas, similar to how cancer can spread throughout the body. So just the same way cancer cells are transported throughout the body is the same way endometrial tissues are also transported throughout the body, which could be either via blood or lymph. There is the direct implantation, where cells may attach to the walls of the abdomen or other areas of the body after surgery, such as a cesarean section or a hysterectomy. Thirdly is the genetic theory. Fourthly, we have the reverse or retrograde menstruation theory. And lastly, the transformation or cellular metaplasia, which says that other cells in the body become endometrial cells, like they transform and become endometrial cells and start growing outside the endometrium. Yes, the cause may be unknown, but there are associated risk factors such as a family history of endometriosis, short menstrual cycles, that is a cycle less than 21 days, long and very heavy periods, that is period lasting greater than 8 days, high estrogen levels, nulliparity, and early age at menarche. Menarche basically means the onset of menstruation. So to explain further what we are talking about, so the affected tissue responds to hormones that affect the menstrual cycle in the same way the endometrial tissue will respond to those hormones, basically estrogen, progesterone. So it sheds and bleeds like the endometrium during the monthly period, but the waste blood is not expelled, hence leading to the formation of a cyst. And a cyst is just a fluid-filled sac, and this will eventually cause inflammation, resulting in scarring and then adhesions. It forms adhesion bands. Sometimes endometriosis is asymptomatic, but the most common symptom is severe pain in the pelvis, especially during the menstrual periods. Pain can also be during or after sex, when urinating or defecating. There can be chronic pelvic pain or lower back pain, heavy bleeding during periods or between periods, bloating, nausea, vomiting, fatigue, infertility, anxiety, depression, diarrhea, constipation, and the list goes on. Pain subsides or disappears at menopause. Remember we said it has to do with the cyclical hormonal changes during the menstrual period. So at menopause, women do not experience periods anymore. So the pain actually subsides or stops at menopause. So the moment you start experiencing these symptoms, you should see a gynecologist immediately, as early diagnosis will help manage the symptoms better. Currently, there is no cure for this condition, but treatment is targeted at improving symptoms. So the treatment plan is created based on the age of the patient, the severity of the endometriosis, the severity of the symptoms experienced, and plans for future pregnancy, seeing that I mentioned that it can result in infertility. Treatment plan is mainly focused on managing pain and overcoming infertility, and surgery could be done to remove the ectopic tissue. Unfortunately, in most countries, the general public and healthcare providers are not aware or choose to dismiss distressing and life-altering pelvic pain as normal, leading to a normalization of symptoms, hence the delay in diagnosis and treatment. I hope this helps us to be more aware of our bodies, our symptoms, and seek help for endometriosis.